Pradeep sir as acupuncture and acupressurist, and Shankar sir as a plastic surgeon and cosmetologist. So our vision of UNCCN is medical tourism, which promotes health, educational and recruitment as well to country, to India and to other countries as well. We are running corporate clinics as of clinics, lab, medical stores, 24/7, online and offline clinics with the night clinic concept also. The clinics are in Navi Mumbai, Thane, metro of the cities, India, and also in the international countries. And also we have a research and development program in Indian and international. So it's about UNCCN. UNCCN is healthcare company based in CBD Belapur, Navi Mumbai, having international office in Tampa, Florida, USA. Our core competency is in corporate sector and we are determined to dispense corporate health. We provide a gateway for international medical tourists. UNCCN is the United Corporate Community of Nations. UNCCN believes in the philosophy of Vasudev Kutumbakam, which means the world is in one family. The company was established in 2021. UNCCN is the pioneer of the concept of corporate clinic in India, where OPD facilities are provided to corporate employees at affordable prices with a team of super specialists and the reputed doctors. Our core competency to dispense best physical and mental health to the corporate world. UNCCN also provides all health services under one roof, such as allopathy, Ayurveda, homeopathy, acupressure, acupuncture, sujok, HCG neurofeedback, yoga, and other evidence-based alternative therapies. The corporate health, medical tourism, corporate clinics, Yog Muda are the verticals of the UNCCN. Our presence of the clinic is in India, USA, Middle East and also in the African countries. So, I would like to introduce today's our honorable speaker as Nikhil Varge sir. He is the MD Diabetologist, Department of Internal Medicine, and also runs a hospital in Navi Mumbai. Yes, sir. Good evening.
Namaste. I'm Dr. Nikhil Varge. I'm a physician and diabetologist practicing in Navi Mumbai for past 15 years. Today I'm here to share some insight about good health with you. Health is a concept that has been there from the ancient times. And for the long time, the health advisors or doctors were worshipped as sorcerers and magicians. As we know, in the ancient times, people were doing therapies by means of administering certain drugs or certain herbs through oral cavity, or they were also doing certain procedures on various organs in your body. As far as Indian history is concerned, we have two famous personalities who had brought medicine to our world. And other was Sushruta, who was performing different surgeries in the ancient times. It is documented that Sushruta has done cataract surgeries in the ancient times with the help of some instrumentations. As the humanity has evolved, we can see that from a primitive human beings we have become an intelligent person. And as the technology and the world around us is evolving, we are inviting newer technologies in our day-to-day life. Our old life has changed. Even the farming or the food production has been becoming mechanized in more and more ways. We are using different technologies for our day-to-day work. There has been industrial revolution that has brought a different change in our whole world. And now the revolution is reaching each and every part of the world. And as we gradually westernize our lifestyle, our ancient ways are lost. And this has led to a dramatic change in our health as a matter of lifestyle change. As you can see in this graph, the human longevity is increasing. Now, the life expectancy is almost doubled in last 100 years. Initially, we can see the life expectancy was increasing in a slower phase, but now it has doubled in the last 100 years thanks to the huge revolution that is happening in medical field. We have conquered some older diseases like infections in a big way. And now we have got a control on most of these sanitization problems. And as a result of which, infectious diseases are no more a problem. But this drastic change in lifestyle has brought new enemies to us. And we call them as non-communicable diseases. As our lives are evolved and as our food patterns are evolved, we are getting an access to high carbohydrate diets, and our exercise or physical activity is limited to a large extent. All of us are very much aware and how the technology around us evolves. We all know what generation of iPhone is coming in which year, but are we aware about our own health problems? Are we aware about the lifestyle change that we are facing? So, as the chronic infections are controlled and where our physical activity is being diminished, obesity is a new problem that we all are facing. And obesity is problem across all the globe, across all the continents, from developed to underdeveloped countries as well. Also, our changes are there in the food pattern that we take. We are taking saturated carbohydrates, high calorie diets that cause weight gain. Over a period of time, this leads to obesity. Along with that, there is a change in the microbiota along us. The gut bacteria are changing. The nature of our gut is changing. These isolated phenomena, along with the stress that we feel at the workplace, in the surrounding environment, it is bringing new changes to our life. And as we can see, this has led to a new pandemic of non-communicable disease, the origin of which is with obesity. As the obesity increases, we face different issues like diabetes, heart problems, cholesterol issues, and non-alcoholic fatty liver disease, to name few. Along with that, we are facing new problems like autoimmune disease and neurodegenerative brain disorders, which is you can say a curse because of longevity. Now, this is a graph which shows the mortality because of different disease pattern. As you can see in the bottom area, the yellow area depicts the infectious diseases, which are largely controlled, and the mortality is very much limited because of them now, at least in most of the developed countries. But if you can see the middle green zone, which is because of diabetes, that zone is expanding instead of reducing. DALY, or disability adjusted life years as we call it, are also decreased because of our advances in health. But the obesity problem remains. And as we do not know about obesity, we cannot control it. So we have to understand how obesity occurs in the first place. One thing that I have already underlined, which is about high calorie diet or high carbohydrate diet. Along with that, reduced physical activity or hypodynamia, certain medications that we take, certain genetic changes that we are facing are also contributing to this. Endocrine diseases like thyroid problem, some metabolic problem with diabetes like insulin and glucagon, those hormones, and the stress along with unhealthy eating habit is going to add to obesity. And this obesity, as I told you again, is going to cause multiple health issues. And yes, it is preventable one. Out of the non-communicable diseases, the four major diseases that are of concern are going to be cardiovascular disease, diabetes, chronic respiratory diseases, and cancer. And as the things will progress, our more and more attention will be diverted to these topics alone. This chart here will show you the data of last 2 decades. And as we can see, from year 2000 to 2020s, there is a surprisingly constant proportion of death occurring because of 2 major diseases, which is heart disease and stroke. Both of them can be attributed to ischemic heart disease or cardiovascular disease. So they remain to be the most important causes of death in the communities of urbanized nations. The measures to reduce them are actually simple and are available and accessible to every one of us, but we are not aware of them or we are not alerted for them. So we need to follow a good diet pattern, we need to follow good regular physical activities, and at the same time we should have access to healthcare where these problems can be diagnosed in early stages and they can be well controlled with the help of doctor's advice or medications. Now there are different countries which have the program started for healthy lifestyle center, or they can also be called non-communicable disease control centers. Most of the populations in all urban or rural areas is now facing this pandemic. And it becomes our utmost duty that we bring your attention to this problem and to the ways by which this can be controlled. So as you can see, it is an integrated service comprising of different health specialties, from diagnostics to therapeutics to interventions. And these interventions are going to make the strategic change that we want to see in the future. Again, to stress here, obesity. Obesity is the origin for multiple health issues, starting with diabetes, hyperlipidemia or bad cholesterol levels, obstructive sleep apnea, hypertension, and these all culminating into cardiovascular disease like heart disease or stroke. Once we decide that we want to control them, yes, we can, and that is the talk for today. It is not only these things, the surrounding around us is changing. The stresses are of different type. There are personal stresses from the family, the professional stresses at the workplace, plus different addictions that we are culminating into. We have access to so many addictions. Money is available with everyone, and these smoking of tobacco or alcohol are one of the harbingers for bad health. Pollution around us is also increasing, that also contributes. Here, I want to highlight that out-of-pocket expenses in countries like India, or which can be compared with other low or middle income countries, is very much higher. Because these are the countries which do not have social security schemes like most of the developed countries like US have. And as a result of which, people have to run on their own to private hospitals and chuck huge amount of money for diagnosis and managing these diseases. And the complications can be coming at a very emergent way, and that can be having an alarming impact on their financial status. So there have been an effort by, you can say, World Health Organizations and various organizations under the United Nations, which is promoting healthy lifestyle. May it be for diabetes, may it be for control of heart disease, there have been different recommendations made time and again to improve your health. To brief or to document a few, these are the interventions, which includes reduction in the salt intake. So if you reduce your salt intake, obviously your blood pressure and your lifestyle will be healthier. We have to choose a healthy diet pattern. From a saturated carbohydrate, we should be going to raw vegetables, fruits, salads, or unprocessed foods. We have to maintain a healthy body weight because that is going to be helpful in the longer run. We have to avoid addictions like smoking and alcohol, and yes, exercising daily is an important part. This has been already projected as one of the important benefiting factors for patients with heart disease and to control or prevention of heart disease. And after that, in 2016, the World Health Day theme was to beat diabetes, where it enlightened this concept of superhuman beings, which will have super habits of eating again the same healthy food, following regular activities, avoiding addiction, and if somebody is found to have some risk factors, or somebody is expected to have a bad outcome, or timely health checks are important. And those who were diagnosed needed to follow their medical advices rigorously by taking medications appropriately, because that can really prevent the future diseases in them. Now there is a data to say that over 700 million people will be having diabetes by 2045, and 3 out of 4 people of these will be living in low to middle income countries like India and Northern Africa. And the most difficult problem with diabetes is only half of the people are aware that they are really having diabetes, and half of them are ignorant. Many times it happens that we diagnose someone with diabetes and the diabetes might be existing for a couple of years prior to the diagnosis. So they are already exposed to higher levels of sugar which are causing risk to their organs. We all know we all age, and with age from the age of 25 to 75, our organ functions go on reducing. For example, our kidney function is reduced by 50% from the age of 25 to 75. Now, if somebody has diabetes or hypertension, their aging will be faster and their organ damages will be faster. As a result of which, any extra abnormal stress, if that is on their body, they will be not be able to bear or cope up with it. This is what happens when they are hospitalized. Now, there is again a data sheet here that is going to say, if you can note it, that there are two areas in this part. And that's why the concept started. Can we reverse diabetes? Everybody would be loving this concept that can we reverse diabetes. But before we understand can we reverse diabetes, we have to understand certain basic facts about diabetes. Why the diabetes is caused. We call diabetes to be a lifestyle disease. And what we mean with lifestyle disease, and faulty abnormal lifestyle is going to make an impact in your body, because of which you are going to diabetes. And what are those faulty habits? There are certain factors which you can control, and there are certain factors which we cannot. So there are certain factors which are modifiable and certain which are not modifiable. So among the non-modifiable risk factors, if you have a family history of diabetes, yes, you are at risk of diabetes. And with the family history, we want to say, first degree relatives, your parents, your brothers, your siblings, your first degree uncle and aunt, if they have diabetes, your chances of getting diabetes are more. With age, your chances of diabetes are going to increase. So that is again becomes a non-modifiable risk factor. But there are certain modifiable risk factors which include physical inactivity and obesity. At the same time, there is an association with certain conditions like PCOD and hypertension. These people tend to develop diabetes over a period of time. For us, as a medical graduates or medical students, we know there is an ominous octet which contributes to the development of diabetes. Some of these concepts are simpler, you will be able to understand, but just I would want to reiterate here. Number one cause for diabetes is improper secretion of insulin by pancreas. Now, pancreas has an organ which is called beta cell, islet of Langerhans, which has beta cells, and these beta cells secrete insulin. Insulin is an important hormone which is responsible for lowering the glucose in your body. At the same time, it promotes uptake of glucose by different cells in your body. These islet of Langerhans have one more cell, which are alpha cells, which secrete glucagon. So if you look at the point number 2, this pancreas also secrete glucagon, which has an exactly opposite function to insulin. Insulin's function is to reduce glucose levels, but glucagon on the other hand has a function of increasing glucose levels. So it is said that in diabetes there is an abnormal balance of glucagon also. The third major organ is going to be liver, because liver acts as a regulator of glucose level in your blood. Whenever the glucose levels are high, the liver is supposed to take the glucose and store it in the form of glycogen. And whenever the glucose level drops, the liver is supposed to release the glucose in the bloodstream. Now you have to understand that blood glucose has to be maintained in some normal range, because there are certain organs in your body which cannot use anything else other than glucose. And the most important of which is brain. Brain is categorically dependent on glucose and glucose supply alone in your blood. Now there are certain other factors also. There is a hormone called as incretin, which is released by intestines and which tends to modulate the action of insulin. Also, the fat cell in a person with diabetes have increased lipolysis, and this releases extra free fatty acids in the bloodstream that causes dyslipidemia or high cholesterol levels. Kidneys, which are having a function of reabsorption of glucose if it is excessively released in urine, in diabetes they are also faulty. They absorb unnecessarily higher glucose. Muscles, which do not require insulin in an exercising state to take glucose, require insulin, and if in a diabetic person the insulin is abnormal, they will not be able to take glucose. And in the end, the last but not the least, brain is also responsible for releasing certain neurotransmitters which are important. Now, once we know that how diabetes is caused, we have to also understand what diabetes will cause to your organs. As these organs are also responsible, they are also getting affected. They are also getting the damage because of diabetes. To start with, heart. Yes, most importantly, the heart diseases are very much prominent in a patient with diabetes. This is so common that heart disease and diabetes are considered to be equivalent. What I mean with that is, a person with diabetes is considered as good as having one episode of heart attack in the past. So that is the risk of heart disease in a patient with diabetes. Also, the risk of stroke increases in patients with diabetes, and not only stroke and heart disease, the blood vessels in the lower limbs, or we call them peripheral arteries, can get blocked because of a process called atherosclerosis, which is equivalent to deposition of cholesterol in the inner layers of the blood vessels. So we saw that diabetes can affect these important organs. Along with that, there is a major impact on the organ called as kidneys. Now we know that kidneys are so vital for your day-to-day function that without kidney function, a person cannot survive even for one day. But gradually this kidney function gets depleted, and later on these patients end up on dialysis. All of us might be aware what dialysis is. And if you look at the number of patients on dialysis, almost 75% people who are on dialysis because of diabetes or diabetes related complications. So these are the major organs that we think of. Yes, there are some other issues also, that the diabetes can cause a permanent blindness because of affection of the retina of the eye. It can cause nerve damage in the legs, and then some people will get diabetic foot or non-healing ulcers, for which many people require amputation. Yes, diabetes again is the leading cause of amputation of lower limb across the globe. So that is why we want to stress here that you have to be aware about what are the symptoms of diabetes. And as I told you, that 50% of the people might not have any symptoms of diabetes, but those who have will have atypical symptoms. Many of those people will have excessive thirst and excessive urination. We clinically call this as polyuria and polydipsia. Some people will have excessive craving for food and uncontrolled hunger. That can also be a sign of diabetes. Some people will have extreme tiredness, fatigue, and unexplained weight loss. And few people are brought to medical attention because of non-healing ulcers, non-healing wounds. And you will be surprised to know that diagnosis of diabetes is so simple, that anyone or in any of the companies and communities and hospitals, we can do a blood glucose level which gives reading within 5 seconds, and we can at least make sure that the sugar levels are within a range or they are odd. And those who are having the sugar levels in abnormal range should be of course subjected for more rigorous testing by blood glucose levels. Now this is how we look at the blood glucose levels. Once we check the values, the cutoff for diabetes is documented to be in a fasting state. If the sugars are more than 126, we call it to be diabetes. In a post-prandial or post-meal station, if the sugars are more than 200, still we can label it to be diabetes. Nowadays we use a more advanced tool which is called as HbA1c or glycosylated hemoglobin, which makes things simpler for us as it is an average sugar control for the past 3 months. A value more than 6.5 is absolutely diagnostic of diabetes. So many times it will happen that the fasting and post-prandial values might not give us a correct value, and in that case this HbA1c will be there for our rescue. Now as you can see in this picture, though the fasting levels are projected at different levels or diabetic levels cutoff are set at different levels, the normals are way below it. In between is a zone we call to be a pre-diabetic zone. And this pre-diabetic zone is something where if we act properly, we can prevent these people going into a diabetic level. And as for the treatment, also for prevention, this peptide works fine. If you can see again here, as we discuss about non-communicable diseases or lifestyle changes, the emphasis is on the healthy diet. Healthy diet again in the form of unsaturated carbohydrates or complex carbohydrates, raw vegetables, fruits and salads is the main course that we want to follow in the diet for diabetes. And if it is accompanied with exercise, nothing like it. Doing a physical activity at least 150 minutes in a week, or you can say 30 minutes a day for 5 days a week, is going to be one of the most important parameters which is going to help in prevention as well as control of diabetes. And that's why we always try to convince our diabetic patients that you have to know your disease well. 60% of the control of diabetes is in their own hands just by controlling of diet and exercise. And rest 40% lies with the healthcare professionals. Obviously, if these two areas concentrated properly will lead to weight loss. And if you ask me, I'll be more interested in losing inches than kgs. What I want to stress here is abdominal obesity is the risk factor for diabetes and lifestyle diseases, and it can also be seen in people with metabolic syndrome. So we are more interested in losing the abdominal obesity or abdominal fat than losing the weight in kgs. Of course, if despite of that you are going to require medicines, those should be rigorously followed, and at the same time you will have to maintain abstinence from the addictions. Now there are different ways and different theories about diet, but what we commonly advise is a small frequent meals where your body will not be loaded with carbohydrate load. So a person should take small meals of complex carbohydrate at frequent intervals. So this will let the body adapt to the sugar changes, and probably the metabolic effect of uncontrolled sugars will be minimized. We tend to insist that there should be high content of proteins and low content of carbohydrates. On a simpler way, we try to project a quadrant way. In a plate, only 1/4 of the plate should be filled with carbohydrates, or 1/4 of your diet should contain carbohydrates. Less 2/4 should be raw vegetables or non-starchy vegetables and raw vegetables. So this is how we are going to control or prevent diabetes in the future. Protein content is also important, and those should be high quality proteins. Yeah, it becomes a problem in countries like India where the diet is predominantly vegetarian. But protein are an important source, and protein should be there in the diet. Now there are certain food items which are called zero calorie foods which do not have any calories in them, and obviously as for snacking or to beat the hunger, we advise people to follow zero calorie foods. Now as we discussed, we want to project a model, or we want to collaborate with a model which gives healthy equity across populations. So population all across the globe should have access to good healthcare advices and good medical advices, and that is one of the priority that we bring in here. So even in India, the discrepancy exists between the urban versus rural surroundings. Urban populations in India have access to best of the healthcare, but that is not available to rural population. Through this center, we are also trying to give access to them to the best possible healthcare. And as you know, as far as screening is concerned, we are going to screen the patient for lifestyle diseases, as well as we want to bring a change in their lifestyle so that these non-communicable diseases can be controlled. We believe healthy body and healthy mind together are going to lead to happy life. Maybe in subsequent sessions, our center will bring to you how to keep the mind in a healthy state. But today we are discussing about healthy body. So coming back to reversal of diabetes. So there are certain facts which are proven, and there are certain more areas where the research is still going on as far as the reversal of diabetes is concerned. And what are the facts? Now you have to understand there is a ABCDE mantra for reversal of type 2 diabetes. What we are talking about is type 2 diabetes, because type 1 diabetes forms a very small chunk of patient of less than 10% diabetes. And that is the diabetes which is dependent because of it is caused by absence of insulin and has to be treated by insulin. But there is a type 2 diabetes which is the common form of diabetes and which has potential to be controlled by your lifestyle. So I was talking about A, B, C, D, E about diabetes control. First is A1C. Now those patients who do not have markedly elevated A1C, as we saw just now, the A1C cutoff is at 6.5, but if you are at 7 or 7.5, your chances of reversing the diabetes without medications are pretty high. This is a proven fact. While if your A1C is already more than 10, you will require some or the other assistance in the terms of medications to control the diabetes. Second part is B, body weight. Now we thought that obesity is going to be the contributing factor for diabetes, and if you control your obesity or if you control your body weight by regular exercise and diet, yes, your diabetes can be reversed or it can be definitely prevented. We have seen many people from a pre-diabetes rate, and it is a scientifically proven fact that people from pre-diabetes can go to normal with just diet and exercise strategies alone. C is a C-peptide. C-peptide is a molecule which is secreted from the beta cell of pancreas along with insulin. So, a good C-peptide level means your insulin secretion is well preserved, and those people having good C-peptide levels will always stand a chance that their diabetes is reversible or is possible. Next part is duration of diabetes, that is D. If a shorter duration of diabetes or recently diagnosed diabetes is there, it stands a good chance that it can be reversed. And last part is E, enthusiasm. Unless and until you are motivated strongly enough, you will not be able to reverse your diabetes by your efforts alone. In India, we also take efforts of, we collaborate the efforts with technology. Now there is a thing that I am associated with, there is a concept of DiabeFly. It's an app which helps you regulate your day-to-day calorie intake, and also it integrates with your exercise schedules. With this technology integration, of course, it is possible that we will achieve a better control on your diabetes and give better results. Now there are medications. Unfortunately, with the advance of science, the medications are available all across the globe at a cheaper cost. And there are medicines on both sides for treatment of diabetes as well as for prevention of diabetes. And who are the people who require prevention? Those at high risk of getting diabetes should be given an option to prevent diabetes with medications. Now, who are those candidates? Those people whose parents had diabetes at a younger age can be given certain medications through which the diabetes can be prevented. You might ask me, what is the benefit of this? I'll try to give you an example. If somebody was going to get a diabetes at the age of 45 and you give him certain medications and prevent the diabetes or postpone the diabetes till the age of 50, now that person is living with 5 years extra without diabetes. So by the time he reaches 60, he has 10 years of diabetes instead of 15 years of diabetes. The problem with diabetes is the same, because the diabetes immediately will not cause you any troubles, but over a period of time it will have changes which are almost irreversible. So lesser duration or lesser life lived with diabetes is going to be better for the individual. That's why it makes a really important point and imperative effort that we should at least prevent diabetes or postpone it to a later stage. We all want that you should be living not only longer, but you should be living a well life. Wellness is the concept for today. Prevention is a better strategy, and we all want you to prevent diabetes, and not if you are able to prevent diabetes, at least you should be able to prevent the complications of diabetes which will make you go to the hospitals and suffer a lot. We don't want you to age and age with disabilities and be dependent on others. Rather, we want you to live a healthy and proactive or productive life even at the later stages of your life. Again, I am reiterating the fact, because the discussion was about reversal of diabetes, that can diabetes be reversed. Now here I want to underline a fact that diabetes is not a disease, diabetes is a tendency. For example, it doesn't matter what kind of diet you are taking, because to some extent your body's tendency to develop diabetes or high cholesterol is also genetically determined. For example, you will see certain individuals who take a lot of sweets, but they don't get diabetes. On the other hand, you might also see individuals who do not take any sweets, they get diabetes. So I will say you can not completely reverse diabetes, but probably you can put the diabetes in a remission. Remission is a stage where diabetes is well controlled, and sometimes even without medication it can be put. But will your diabetic tendency go away? Probably it will take more time to scientifically prove that. Because if those people who are in remission, they leave their diet patterns or controlled diet patterns and they do not follow their exercise, they can again become diabetic. So I will not say we can reverse the diabetes, but we can put the diabetes in remission. So these are the facts that we need to understand. Okay, can diabetes be reversed? I'll say maybe, yes. Healthy eating, exercise, weight loss will help some of the people to reverse diabetes. But again, I'm insisting, it's not a cure. We might reverse the diabetes or put it in the remission, but we might not be able to cure a person from the diabetic tendency. Yes, for that, we have to take the action today. Check yourself. Are you obese? Are you at risk of diabetes? Then you should go and get yourself tested. And if you have found yourself in a pre-diabetic range, take the measures to control it here and here below, because that is going to prevent your progression to diabetes. I am going to again insist, lose weight if necessary. If you are overweight concepts can be calculated either by body mass index or by waist circumference. But if you are overweight, you should make an effort to lose that weight, because that is going to be helpful. Though I tried to simplify it, yes, it's pretty much complicated to manage diabetes and to make a proper understanding of diabetes. But yes, we are there to help you, we are there to connect with you, and we are there to solve your problems. So we will definitely keep meeting, and that's why we keep on saying that to keep the body in good health is our duty. Otherwise, we shall not have a strong mind which will be productive. This was the saying of Lord Buddha. I thank you all for your patient hearing, and I will be here to take any questions if you have.
Yeah, thank you, sir, for just a good, informative and very knowledgeable session. It was really very clear. Most of the people might have cleared the many queries of it, but I would really like to know, there are some queries from the people, like, is type 2 diabetes very serious matter?
So as we discussed, the diabetes is a lifestyle disease and it damages the organ over a period of time. So if you are diagnosed to have diabetes today, probably you will not face any problems immediately. What we are suggesting, any intervention or control of diabetes is for the future. If we do not control your diabetes today, probably 5 years or 10 years down the lane, you are going to face serious problems which are going to be difficult. Let me quote you with an example. Now if you see, nowadays we see a lot of younger patients with heart diseases, a lot of patients getting heart attacks, and when we do their angiographies, we see there are problems. Now if you compare a 50 or 60-year-old individual with a heart attack in a diabetes versus a non-diabetic person, a diabetic person will have lesions in multiple vessels of heart. So such patient will probably not be treated just by angioplasty, and he will require bypass, because the results of doing an angioplasty in diabetic patients are poor. So this impact of diabetes is time dependent. How many years of diabetes you spend with is going to decide what kind of outcomes you are going to get. So I will say diabetes is a serious problem because it is going to lead to a bad future.
Okay, thank you, sir. Yeah, now next query is high BP related to diabetes?
Okay, now I will say the blood pressure and diabetes are not actually coming together, but their origin is same. As I told you that we talked about non-communicable diseases, which are lifestyle-borne diseases, hypertension and diabetes. Both are coming from the same stressful or changed lifestyle. So many times it happens that people with diabetes will have hypertension and people with hypertension will have diabetes. And together they are going to cause more damage to your organs than being alone. Again, I would like to quote an example. If somebody is having only diabetes, their kidney function will decline over a period of time. But if they have hypertension and diabetes together, their kidney function is going to decline quite rapidly. So that's why we have to screen in a person with diabetes whether he has hypertension and control it in a better way. And if a person is hypertensive, we must try and see whether he has diabetes.
Okay, yeah. So as we have talked about the remission of diabetes and all other things, so people might have got confused that are there type of diabetes, like we have heard it, type 1 diabetes and type 2 diabetes.
Yeah.
So most people might be having a query, what is type 1 diabetes and type 2? So can we just let me know the elaboration of difference between type 1 and
So
type
as I told you, the commonest type of diabetes is type 2 diabetes, which is present in 90% of the individuals. Less than 5 to 7% of the individuals will have type 1. Now type 1 diabetes occurs in younger age. Generally it starts from by 10 or 20 years of age. Most of the people with type 1 diabetes are lean or thinly built individuals, and due to some reasons, that can be infections, that can be autoimmune diseases, or that can be certain genetic factors which will lead to absence or slow decline of insulin secretion in these patients. So by the time they reach their second decade, by 15 or 20 years, most of these patients will have almost near absence of insulin secretions in their body. Now this is not a lifestyle borne disease. This type 1 diabetes is caused by some other factors, some environmental factors which can be in the form of infections, some viral disease or something, or some damage to pancreatic insulin secreting cells. So as a result of which they become dependent on insulin. Fortunately, they are diagnosed early, and whenever they have these problems, and they can be treated in a proper way with using insulin. But the only problem in these patients are they can be treated only with insulins and not with oral medicine, because oral medicines require some form of insulin secretion to be present, because most of the medicines will act through those insulin secreting cells. So in type 1 diabetes, the only option that you have is going to be secretion, injections of insulin. But if you look at type 2 and type 1 diabetes over a period of time, if you have 20 years of type 1 diabetes or whether you have 20 years of type 2 diabetes, the long-term complications are going to be similar.
Okay.
So most of the individuals who get diabetes in a later stage, say for example after 35, 40 years of age, and those who started with obesities, belching bellies, those are the people who will generally have type 2 diabetes. Now type 2 diabetes is a mixture of multiple things. They have some deficiency of insulin, some resistance to the action of insulin, and some other metabolics by other organs, as I have highlighted. So it's more of a lifestyle borne disease, type 2 diabetes.
Okay, thank you, sir. So we have a next question over here. How stress can be correlated with diabetes?
Yeah, as I tried to tell you, now we face different kinds of stress. As I told you earlier, that we face stress in different way. We as humans were meant to follow certain circadian rhythm. We are supposed to have food at certain times of a day. We are supposed to have sleep at certain times of a day. But now these things are changing. We work in shifts. For example, we work in night shift. As a result of which, what will happen is our circadian rhythm is disturbed. When we have a circadian rhythm, there are different hormones which are secreted in our body. We must have heard of thyroid. We must have heard of steroids. We have endogenous steroid secretion. So whenever we are not able to follow this circadian rhythm and our lifestyle changes, this stress puts us in a shape where we have excessive secretion of steroids. Now this hormone is also known to be contributing to abdominal obesity and to insulin resistance. So stress will lead to abnormal secretion of our hormones, and that way it can lead to obesity. I will not say stress directly leads to diabetes, but stress leads to obesity first, and then in a later stage it can definitely cause diabetes.
Okay, thank you, sir. So the next question would be, is, as we have seen females are nowadays going on through thyroid problems, hormonal imbalances, PCOD mostly. So is diabetes related to PCOD females or something like that? How
Yeah,
can be
PCOD is documented to be one of the important risk factors for diabetes. Thyroid, no, but PCOD, yes. Now, if you see, a lot of people with PCOD also have obesity. They have already presence of markers of insulin resistance. There is an entity called as acanthosis nigricans, which is about dark pigmentation of skin in the nape of neck or in some other areas. Now, this finding itself underlines that there is a presence of insulin resistance. So, PCOD people are, yes, they are at a higher risk of developing diabetes, and that's why if you look at the management of PCOD itself, we ask the people to lose weight. We ask them to follow regular exercises. This problem is going to help their PCOD state as well as their insulin resistance. Similarly, there is a condition called as gestational diabetes, in which women during pregnancy develop diabetes. Now, this diabetes to some extent gets normalized after delivery, but these females are always at higher risk of developing diabetes in next 5 years after delivery.
Thank you. So the last but not the least question, people might be about hearing all such questions. Now they are into the thing matter like, is diabetes reversible if the patient is having as for like 4 to 5 years back? So is it?
As I told you, the diabetes should be taken as your body's tendency. And if you make a genuine effort, yes, you can come to a state where diabetes can be reversed to a level of remission, in which you might not require medicines, in which you can live a healthy life by following just diet and exercise. But as far as I know, as far as my experience is concerned, I currently treat around 5,000 families with diabetes. So in those patients, many people have followed different diet patterns, different lifestyle patterns, and they have found that they need to follow those advices on a longer run. Whenever they lapse on that part, that they do not follow the health advice or they do not follow a healthy diet or exercise patterns, yes, they eventually get back to the diabetic level. So I will say the diabetic tendency does not go away. So everyone should make an effort that we do not become obese, or we fight with obesity in such a way that we do not develop the tendency in itself. Once you develop a tendency, because this tendency is developed over a period of 25 to 20 years. So somebody from the age of adolescent stage, once you go into graduation, from that, what kind of lifestyle we live decides whether we will develop a diabetic tendency. And over a period of time, if you have developed a diabetic tendency, I don't think we can reverse that completely. We might be able to control the diabetes, but diabetes reversal is a distinct goal which we have, and there are a lot of people who will, kind of make claims that we will be able to reverse diabetes, but with almost all of the things, for the last 15 years I am working in this field and I have seen people going to different forms of therapies. Yes, they can control the diabetes, but the diabetic tendency doesn't go away.
So
that is something.
Lifestyle only means what the person has to adapt it, and the lifestyle they have to change it. Okay.
Correct. So I would again urge here that prevention of diabetes is more useful, that you shouldn't develop a diabetic tendency than going back to or reversing it. So prevention is always better than cure, and I want to underline the fact here again.
Sir, we have one more question for this. What precautions apart from diet for the pre-diabetic patients should take actually?
Again, exercise is the most important part. And what we mean with exercise here is aerobic type of exercise. Aerobic exercises in which you have a complete activity of all your muscles and organs. So I would suggest you should be doing jogging, cycling, swimming, or some form of sports activity. Now they form aerobic exercises. Going to gym and weight training probably will not be the right kind of exercise which will be helping you. You can do part of it, but moreover you will have to do cardio aerobic exercises, because they will underline the fact that they will have a huge impact on your all organs which can contribute to diabetes.
Okay, yeah. Thank you, sir, for your valuable time and just giving more informative about the diabetes. Hopefully people are now more aware of the diabetes and they will take care of themselves. With prevention is better than cure, and do let us help to you and just come and connect to us. UNCC and Corporate Clinic at Belapur. Thank you very much. Yeah, fine.
Thank you.